Over the last weekend, had a case of suspected monkeypox. Clinically, the person had all the signs and symptoms of monkeypox, and we have been able to confirm that by using PCR to do the confirmatory diagnosis. So we now have our first case of monkeypox in Guyana, and we have since isolated the patient, so that patient is now in an isolated area at the Ocean View Hospital, and that patient is stable and is doing very well. The persons who the patient would have been in contact with over this period, we have also spoken to them, and they are right now in quarantine. So while we have our first case, as you know, we have been preparing and taking precautions to make sure that, one, whenever we have a case, we'll be able to detect that case properly and confirm it with our laboratory analysis. And this is what has happened. Now, with this case, we are taking all the necessary measures, and I want the public to know that we have diagnostic capabilities. We have our labs that are prepared. We have a lot of people who have been trained. Over the last couple of months, we have trained a number of physicians. We have trained a number of laboratory staff, just in case if we have cases, what to do. So I don't want people to panic, because monkeypox is not something that is readily transmissible. You have to be in very, very close contact with that person, and with the lesions on their skin and the liquids that come out from those lesions before you can actually get sick. So this is something that I'm sure once we continue managing it as we are doing right now, that people would be quite safe. In the region, they have had cases in this region, in the Caribbean region. In Cuba, they had detected one case, and they have managed that. Barbados had a case, they have managed that very well. Jamaica has 4 cases, they're managing their cases. In Bahamas, there was a case, and they have managed that well. So once you manage it properly, you're not going to see a lot of people getting sick. In Brazil, they have more than 3,000 cases, but again, Brazil is a large country with a big population, and they're also managing these cases. So once we follow the guidelines that we have set up, I think people are going to be okay, but we want people to understand that we have a case and that they must take all precautions so that we don't have spread.
Okay.
So we are hopeful that persons would be so guided, and we'll continue to work with the public by disseminating this type of information.
Okay. Could you tell us maybe a history about this individual? Did they come into the country? Are they a permanent resident here? The age and maybe the gender?
This is somebody who has been living in Guyana, person from Region 4, and the person is in the 50s, male. So they start developing these signs, and they came to the hospital, and because the system was alerted, the doctors felt that this looked like a suspected case of monkeypox, and they follow the protocol that we've established, one of which is for us to take samples and then to run it in the lab to confirm whether it's monkeypox or not. So we have done that, and we are now in a position to confirm that it is monkeypox, and so that person now has been isolated.
Okay. Moving over it.